Okay, first of all, thank you for your attendance and being on time. Of course, this change in this channel is in accordance with the academic supervisor because, well, I had many situations with my son at school. And today at night I had a meeting. Not interesting, but I had to be there. That's why I had to change the class. So in order, I was telling you at the beginning, Maria and Grace, let's wait a little bit to your classmates. And well, I think we can start in 5 minutes, no more than that. As you could see, I think I sent the slides from today on Wednesday to the WhatsApp group in order to start checking the vocabulary, details maybe. And while making a fast review, I found some mistakes in the typewriting slide, small details, but well, details are present. So let's wait a little bit. And patience, I think I can correct it while finishing and then send it again. And well, finishing the class, I'm gonna send the key answer of the homework 3 because we had enough time to do it. And well, that's all. So let's wait a little bit. I'll be back in 5 minutes and we start in 5 minutes.
It's okay, doctor. Good night.
Okay. Let me see. Do you think it's the moment to start now? Or do you prefer to wait a little bit?
I think we can start, teacher.
Okay, perfect. So let's
night.
go. Good night, Jasmine. Thank you. So let's start. Let me share the screen. I'm opening the PowerPoint. Well, as you could see, it's not a very long presentation. It's very short with lots of details to talk about and to explain right in that order. Well, we are going to talk a lot, I think. And well, there's a lot of vocabulary that I decided to place at the end of this model because taking into account the contents and the time we have for preparing the medical vocabulary as a priority, well, it's better to do it in that way. If we do it at the beginning, at the end we might have, well, anatomical landmarks, reviews, and lots of information to check. And it's not correct, in my opinion. That's why we are going to talk about these topics at this moment. Let me see, can you watch my screen? The green one?
Yes, teacher.
Okay, perfect. Okay, let me get it bigger. Perfect. Let's go. Well, today we are going to talk about medical practitioner 1 and 2. 1 and 2 is just a difference in the list for dividing the topics about nurses and allied medical professionals. Very important professionals, of course, because in order to make a better job, we receive their support. And receiving that support, it's easier to make our activities, to complete the treatment and everything, okay? About medical practitioners, 1, we start making some definitions, giving some details that are very important, okay? A medical practitioner is a doctor that must be qualified, that have a university degree in medicine, and it must have to be registered in order to practice medicine, of course. If someone who says that is a medical practitioner and is without qualification, without a register, of course, is not allowed to do it. It's going against law. It's making a huge problem, I think, because, well, we really need to get this qualification and register. The clinician is the doctor who makes research and treats patients. The general practitioner, the GP, we were talking all the course about the GP, is the doctor who provides primary care. And general practitioners usually work in a group practice. I mean, we as a general practitioner, I cannot make everything by my own. I need people working with me as a team, I think. When we finish the medical school, we all get GPs, general practitioners, and according to the specialty we choose, we can become a clinician, a physician, a surgeon, and everything we are going to check in this slide. The specialties, of course. First of all, generally, they work in hospitals, the specialists, right? Usually in private healthcare, and may have consulting rooms outside the hospital, of course. Private attention, right? We must consider that the two principal branches in medicine are surgery for surgeons and internal medicine with physicians, doctors who don't develop any surgical procedure. According to that, in taking this division, we consider all the general branches. Okay? So we know we have 5 general specialties: surgery, internal medicine, pediatrics, gynecology and obstetrics, and public health as a general view. And from them, if we think a little bit, we have surgery and internal medicine for taking it divided. About the names of a specialty, they usually end in ology. Names of specialists usually end in ologist, the one who develops an activity. The name of a specialty ends in ICS. The name of a specialty ends in Isian or Ion. I mean, physician, surgeon as a general example, right? In the previous slide, I said a clinician is the one who develops research and treat patients. I mean, a clinician are not all the doctors become clinicians, I mean. Not all the doctors have the opportunity, have the chance to make research in order to prepare new treatments, to evaluate vaccines results and activities like that. Usually, the doctors that make research are the ones who are into a hospital taking a group control. We are going to talk about this epidemiological details in the module 2, but that's why it's like an introduction of this. The clinicians are the responsibles for preparing, controlling, and following the results according to the research they are preparing. And following that research, they are making treatment. A general practitioner who's into the community, in town, in land, I know everywhere, it's not a clinician, because you don't have the chance to control a group with all the rules that really needs for make a real research with a medical purpose. Okay, just as a detail for being clear on this part. But don't worry about it, we are going to take it properly in module 2. About choosing a specialty, of course, we all have the chance, the opportunity during the whole career to prepare this opportunity, could be said, to prepare the path, the branch we want to work. And we all have the chance to look for information, to practice on almost all the specialties. In English, of course, the specialties are the same than in Spanish, but the procedure to reach one or another might be different. It doesn't mean that it's not a long process. Of course, it is. From the first year, I think we are dreaming and thinking what I'm going to become as a specialist, what I'm going to do in future, I don't know. Questions like that. That's why we have to take it easy. We have to be calm. We must consider that there's the general branch and there are subspecialties and there are more specific topics, and according to the time, through our practice and opportunities, we have the chance to get the correct way, I mean. This diagram is just a joke, I mean, just a joke because they are giving you some specialties in blue, but they give you a general idea for having fun, how it's possible to get clear what kind of doctor I am and how do I really like to move, how I feel better practicing medicine. In my case, I'm here in emergency medicine. Do you have ADHD? Well, I have ADHD, of course. I need to be in action. I need to stay in movement. I need to be with lots of topics in mind. And it's not an easy way to admit or to accept that I'm done for this, for the emergency room. On the other hand, there are in this group, I'm not sure, at this point, I'm not sure if we have residents, but at this point, if you think on this and read it carefully, you are going to see that these questions, in order to be a joke, they have the reason for giving you a general idea what do you really like, what you really, in which area you're better doing your best. That's only to be sincere, to be clear, to be honest with ourselves and choose what we really love. And as you can see, we have lots of abbreviations in medicine, in specialties too. So check this information just as a detail from this point, because of course abbreviations from these slides are going to be into the module 2. When we talk about medical practitioners too, we consider the rest of the team we are working on, right? The staff is the people who work at any type of workplace. Could be a hotel staff, a restaurant staff, I don't know. The hospital staff is everybody that is working into the hospital, from the maybe academical activities we have at the hospital, the administrators, the security wards, I don't know. Everybody that's into the hospital, of course, doctors too, are the medical staff. And the staff as a general concept, we must remember this for not getting into confusion. Just going to the point, the medical staff has usually this structure. This is an interesting guide because we have the opportunity to understand, to catch in which step we are, and then consider this. We can go from this. The medical student is the one that is in college at this moment, in the medical school. In the last year of the career, we have the interns. Of course, in some countries, interns have lots of responsibilities, including treating patients, making their own diagnosis, and practicing their own medical way of thinking. Very important activity, because that's the basis of the future job. When you finish your internship, you leave the hospital, become a general practitioner into this space. And you are here in the non-hospital place. When you approve the admission, you get admitted into residency course, you become a resident, like her. According to the branch, to the specialty you choose, the residency might last 3 to 5 or maybe 6 years. Of course, according to the specialty, the place, the university, the country you are developing this activity. It's not the same in every place. When you finish your residency course, you become a fellow and a specialty who has the opportunity to stay at the hospital for continuing your post-residency training. When you become a fellow, you automatically become the professor of these 3 steps, from residents, from interns, and of course, medical students. According to the specialty you got, there is a process a few years you have to be a fellow with lots of steps you have to follow to finish this step. You become an attending. An attending is the chief, the service chief, we can say, in this country, and is the one who is with all of the registers and can decide by its own as a specialty, as the responsible of the service, we can say. The fellow is still training for becoming an attending. The attending is the principal, the chief of everybody, and of course the professor of everybody. The attending is the responsible in the service for becoming, is responsible in the way of teaching and practicing medicine for all of them. So you can see it's not easy to achieve, to get this goal, but we can do it. Talking about the hospitals, the hospital staff, we consider the hierarchy of of the most important places, I think. In USA, for example, we have the dean of the hospital. We have a team, a group of professionals, of investors, investigation, I don't know, lots of people that are giving money to the hospital in order to get it working. This group has a dean, has a leader. This leader is the public face, we can say, of the hospital. Then become the hospital administrators. Okay, we all know what administrators do. And then become specialist surgeons at the beginning. Why surgeons? Because they are the ones who are used to send the most guidelines, the most details to prepare the worldwide protocols. Okay, when we said normal specialists, the normal specialists are the clinicians, the non-surgical specialties, I mean. Emergency medicine, for example, is between specialists, surgeons, and normal specialties. We are into this space. So we have to get trained in clinical branches and the surgical branches. In that order, we have the chance to do it. Silent doctors, of course, are colleagues that have the chance to stay working, have the opportunity to become, to get into the residency course, but they are still in the process of being admitted. They cannot stand all the decisions, they cannot support all the activities at the hospital, but they have the chance to be there, to practice, to get used to the hospital, and according to them, if they approve the residency test, the residency admission test, they become residents and are into this space. But silents are very important. Why? Because they move from every place and help taking decisions for not missing time, not wasting time, for working in the best way for doctors, I mean, for specialists. Then we have the nursing. Of course, all nurses are our best friends, in my opinion. Well, they must be. Without them, we cannot work properly. We as doctors give the order, we send the indications. The ones who develop, who prepare these indications are nurses. That's why they are important. We have the physician assistant. They are general practitioners that are in the first steps in order to being prepared to becoming silent. And then these physicians are like the ones who get organized clinical histories, clinical reports, who prepare all the documentation in order to be clear what they are planning to do. They are following all the administrative activities for not missing or mixing the clinical records, of course. And then all of them, the ones that are up, can develop properly. And then become the medical students or interns. Med students and interns, of course, are important. They help us a lot, every place. And that's one of the best activities. In Australia, we have a different hierarchy. We have the senior medical officers. The seniors are divided in general practitioners, staff specialists, and career hospital doctors. Careers are professors. Just prepared for teaching, not for assisting people, right? Then we have the visiting medical officers, the registers, the principal house officer, resident medical officers, and then we have the senior house and the junior house and the interns. Senior and junior are different in order to the year they are working and preparing to the residency course. The rest of this division, this hierarchy, well, I decided to send this slide in order to compare the medical hierarchies, hospital hierarchies, I mean, are different, very different from one place to another. Here the physician hospital hierarchy, we have another process. And then we have the attending physicians, hospitalists, house staff. Three of them are the professors of the service, we can say. The attending are the ones who are in the consulting room. Hospitalists, the ones who are into the hospital just. And the house staff are the rest of the doctors, we can say, the colleagues that are interns on shifts, exchanging places, moving into towns. It's very common to see this hierarchy in Asia, in India, maybe in some places in Latin America, but I'm not sure exactly which countries. For example, in Cuba, I have the chance to study that, as you know. The house staff were the doctors that used to go to the community following a role during the week and assisting people in that order just. All of them are fellows, residents, the chief resident, the senior resident, junior resident. We all know about it. According to the year, you are becoming a resident, and then intern. And of course, medical students. This part, junior, senior, chief, and residents, these three ones are the same everywhere in Latin America, every place in Latin America. This is first year, second and third year, fourth and ahead. Well, and the chief resident, of course, is just one resident, that it's the leader of the group of residents. Very important stuff. Okay, about medical teams. Well, we have to consider this, that a team is a group of junior doctors to help care that patients of the consultant physician and surgeon. I mean, I think we all have the chance to check Dr. House at least once. Dr. House is the attendants, the most important, the chief of the service, we can say. And the rest of the doctors are juniors, are general practitioners that are in the process to get into the residency course, or are fellows that are preparing to becoming an attending, and they are the team. The rest of the doctors, different from the attending, from the principal, are the ones who develop tests and move patients from one place to another. Of course, they not develop all the techniques or maneuvers we see in this fictitious series, right? They don't develop surgeries, of course. They all, for example, if you're in the surgical branch, you just prepare on surgical branches. If you're on the imaging branch, you just develop imaging branches. I mean, we all know how it is divided. But to catch the idea of how a team is organized, you have a physician, a surgeon, the consultant, the attendants, and then the fellows are the ones that are doing this, that are doing all the hard job, we can say, making investigation, looking for more answers, making differential diagnosis, thinking and completing ideas for catching the correct diagnosis. That's the idea of the team, of the medical team. The multidisciplinary teams are groups formed by doctors and allied medical professions. Of course, we all know what a multidisciplinary team is. We all have the opportunity and the chance to practice on that. In this slide, we have this paragraph. This one, well, this vocabulary that's in capital letters is going to be into the test. Please check the vocabulary here just. Here in Bolivia, or in Latin America in general, we have the chance to become, to be admitted into the hospital in lots of ways. Could be as from the emergency room, because we have a reason to stay, because it's an emergency, of course. We have the chance to be admitted because we have an order, because a specific situation. Or, well, that's the most important. When we get into the emergency room, usually there is a general practitioner who starts the attention, who starts assisting you because you are the patient. And according to that, the opinion and the support that the general practitioner gets, you are evaluated from a specialty and specialist, and then get admitted into the hospital, right? In USA and UK, it's a little bit different, because we say when the patient enters or is admitted to the hospital, is usually seen first by one of the junior doctors. Junior doctors could be similar to the general practitioner I was explaining now, on the ward, on the shift, where they will receive treatment and care, the primary treatment, the first aid, not after stay, the first treatment and care. The junior doctor, the GP, clerks the patient, takes the medical history and examines and makes the first evaluation of the patient. Sometime later, the register also sees the patient. In Latin America, similar to the register, could be see the resident, could be, I don't know, a doctor that is in charge of the one service when the patient might be admitted. Usually is the resident, or could be the general practitioner from the emergency room. It's according to the place you're living. Well, in USA and UK, the register, the resident, we can say, also sees the patients and may order investigation or tests. For example, X-rays, ECG, okay, I don't know, lab tests. According to the situation, they ask for it, and then give a provisional diagnosis. This first diagnosis must be supported, of course, and begin treatment according the situation it is, right? You don't start the treatment if you don't have a reason, right? Few hours, you receive your reports, X-rays, ECG, lab tests, well, everything. And then the specialist, the consultant, is called to evaluate the case. The consultant usually sees the new admissions, right? New admissions, people who have recently been admitted to the ward. So the first time, no one of the regular ward rounds, when the management of the patient is discussed with the register, right? The ward rounds are that specific moment when the medical team goes bed to bed, evaluating the patients, the new admissions, and the patients that were admitted previously. The ward rounds, of course, we usually have one in the morning, one in the afternoon, and the last at night. for checking, for evaluating how the treatment is working on the patient. And according to the situation, we can go to the patient room 1, 2, 3, 4 times a day. It's, well, we all know how it works. Okay, the consultants also decide when a patient is ready to be discharged, is ready to be sent at home. It's ready to go back to his home, right? On the ward round, the consultant is accompanied by the team, of course, the medical team and the nurse. The consultant usually is this one, is the physician or the surgeon, the principal one of the service, right? The specialist that is in charge of this of the service. And they all visit the patients in the consultant's care. So you can see it's not very different from the structure we have in Latin America, but maybe the definitions might change a little bit. Shifts, one of the best activities we have. I love my shifts, I don't know why. But a medical shift is one in which the schedule is rotating in hours and days previously agreed. Of course, we all know how it works. We all know we have a role, we all know we have to follow this role, and according to that, we can work or not, right? Nurses, our friends, I mean, the witches. We have the nursing grades, just as an example. For catching that they, of course, have their own way of working. We have the student nurse, a nurse who's still in training, the staff nurse, a nurse who has completed the training course, a charge nurse, very important, a more experienced nurse who is in charge of or responsible for a ward or department. We all know they have schedules, and according to their schedules, they change only in the structure. The charge nurse, of course, is not going to evaluate patients, at least it's very important, very necessarily, and they just go to supervise the activities that are at the moment, that are occurring in the moment, right? And we have the nurse manager, a nurse who is in charge of several wards. I mean, the nurse manager could be the one who stays at the hospital as the principal boss of nurses. And considering this is very important because she's the more experienced, and she's the best of this. She has the authority for reorganizing or moving wards of this career of this staff. And well, it's very stressing activity, I think. Why I'm sending this picture? Actually, we know that nurses are like her, in white, very kind and everything. But in past, when this career started becoming serious, we can say during the First World War, well, usually at the beginning, nursing activities were developed by Clarence Nightingale. She's the one, this lady was the one who developed these activities and taking into account all the details that were necessary for saving lives from soldiers. She was taking details and making observation how easy activities like washing hands or changing clothes or changing bedclothes, she could avoid several infections. At this point in the First World War, just ladies, young ladies, elderly, doesn't matter, just women were the ones who were prepared, who were received as nurses for taking care of that kind of people, with a little bit of help of some soldiers that were out of the activity or out of duty. And going through the time and checking that less volunteers were appearing into the war area, they started to ask for help to the church. And the church were used to send nurses who were nuns, who were mothers, like her, right? That's why the nuns were the ones who had the preparation, who had the opportunity to develop this activity without any problem, because it was the sacrifice they had to make in order for serving church. Going through the history, you can check, you can see that in some places, some countries, at this point, there are still elderly doctors, our professors, who still calls mother to the nurses, because it's the traditional way to talk to them. Because of this history, how the volunteer activity was not supported by the society, but the church took this activity in order to help at the beginning soldiers and then the community, going to places that no one wants to go, or taking deceased people that no one wants to assist in that moment, right? So if sometimes you have the chance to talk to an elderly doctor or to go to another place and be assisted in a hospital, and you listen that someone says mother to a nurse, don't worry, it's about that history, that way they started working and supporting this career. Then, well, we have this, the support workers are the ones who has done a short course and obtained basic qualifications. Here in Bolivia, we said auxiliaries, yeah, the nursing auxiliary is an assistant nursing staff. And we have the ward clerks. Ward clerks are, what happened? Oh. The ward clerks are a specific staff, a specific group of people who's making sure that patient notes and information are up to date and answering the telephone. I mean, they are nursings that could be students, we can say, that are sure that everything is organized in the medical history. Everything is done, nothing is avoided, everything is on the place it has to be, and they are the ones who have to check the phone and answer the phone and give some information. Ward clerks don't attend patients. Ward clerks are not in charge of patients. Nurse auxiliary help the nurses. Well, we all know how they do it. I don't know, they move faster, so fast. So yeah, they are great. Of course, nurses could have a specialization. They can become a midwife in some countries. Here in our country, at this point, we don't have the chance, but they can make PGs. But the midwife is the one who prepares, who develops the management of pregnancy and childbirth. They have district nurses, the ones who visit patients at homes, and the health visitors. Also work in the community, giving advice on the promotion of health and the prevention of illness. Health visitors are very common in Cuba, for example, in China, and I think these two countries are the ones who have more health visitors. Nurses who just go to the community teaching and giving promotion about the health and prevention and things like that. About the nurse's role, going through the time, we all know that they only have the opportunity to take care, of course, giving comfort, giving that human contact that sometimes it's not easy for doctors to make, checking temperatures, pulse rate, blood pressure, vital signs, changing dressings, giving injections. Well, we all know the general activities of the general roles and everything. But in some countries like Australia, like France, USA, of course, they have the chance to remove sutures, prescribe some drugs, order laboratory tests in order to get enough time to make it faster. So, I mean, they are receiving more responsibility through the time because they are prepared to do it. Some of them have the specialization to remove cysts and take biopsy if there is not a very aggressive skin lesion, could be said. So according to the place, they have the chance to open in a big branch, a big career. And of course, they have their own hierarchy just for showing. It's not a topic of this point, just for checking that it's a way of working, and it's very, very interesting. About allied medical professionals, we must consider this. It's very, well, at the beginning, they are very important because they help the doctors to develop properly, to make a correct recovery, a correct treatment. So we have to consider them as a very important professionals in order to make it easier, to make it workable, yeah, we can say. So, talking about community health, we have the physiotherapists, the physios. They help people to move by getting exercises or treating their body with heat or massages. I mean, manipulating muscles and joints with hands. We all know what a physiotherapist is. The physios are very, very important, but we must consider that in some countries, physiotherapists just develop these activities. Get exercise or treat the body by heat or massages according to the situation. They help to move better, to recover in an easier way. And we have the occupational therapists, the OTS. They help people with disability to perform tasks at home and at work. A physio is not taking people with disability. It's taking people without a disability, of course, helping to recover activities. But the OTS, the occupational therapist, work just with people with disability to perform tasks. I mean, disability is a physical or mental condition that it makes it difficult to live normally. Could be blindness, deafness. Okay, we all know about it. In some countries, like USA, this division is very clear. You don't have the chance to become an occupational therapist, OTS, and then work as a physio, or the opposite. You cannot be as a physio and then become an OTS because you want to be that. No, you have to be prepared in the specific branch you want to develop your activity. So let's consider these two ways to open our ideas, right? We have the social workers, very important people, because they help people to solve their social problems. For example, housing or unemployment or family problems, in order to get a better medical attention, to receive a better medical treatment, or to improve your way of living. That's why the social workers are a very important medical allied profession to understand the reality of the patient. Some medical situations have the origin from these problems. And according to these social problems, they can make their job, we can say, and it's possible to give a real solution. Then we have the chiropodists or podiatrists. They treat conditions affecting the feet. Of course, they have their own preparation, own material. They know how to do it, sometimes better than us, but we have to consider just as a medical allied profession. It's another career, of course. We have technicians, people who work with scientific equipment. The X-ray technicians, radiographers, the ones who just take the picture, we can say in that way. They don't perform, they don't develop, don't write down the report. They just send us the imaging to the radiologist. The radiologist gets all the anatomical landmarks, details, pathological details, and they give the report, not the X-ray technicians. X-ray technicians, of course, have their own preparation and do everything they consider necessary. They make the position, look if it's well taken, the imaging, and well, they are very important. If they fail, the diagnosis can fail. Moreover, we have the ambulance technicians and the paramedics. The ambulance technicians are that people who work at the emergency medicine service. They, as a technicians, go driving the ambulance, might help to pick the patient up, and that's all. The paramedic is the ambulance technician with more advanced qualifications like this, the PHTLS. The paramedic is the one who's prepared to assist a patient. That's different. In an ambulance, usually goes one ambulance technician and two paramedics. The paramedics for taking assistance to the patients, starting fluids, using some splints, immobilization, for starting treatment, for getting in touch with the hospital that it's in the organization for receiving the patient, the case. And the ambulance technicians are the ones who prepare the ambulance just for picking up the patient and driving as fast as they can. So you can catch the difference. It's very easy. The prosthesis or orthosist provides care to anyone who needs an artificial limb, like this guy. This one, the orthotists have the opportunity to advise on rehabilitation and help patients to return to normal life and work after treatment. They have the chance to help someone to get an artificial limb. In that way, they're very important. The psychological impact is very important. They, of course, prepare the splints, the removal and the fixable, and well, they use to correct deformities, to relieve pain. In that order, they are prepared for making this just for the patient, not general pieces, we can say. The opticians are the ones who are prepared to develop the test eyesight and prescribe glasses according if the eyesight is without any trouble. The glasses are also known as spectacles and contact lenses. The spectacles are these ones, the common glasses, and the contact lenses we know. Okay. The examination of the opticians include the intraocular pressure, the examining of the retina. They are prepared to check normal and abnormal situations, of course. If they find something that it's abnormal, that made them think that it's a suspect of an eye disease, they are referred to the general practitioner. And the general practitioner is the one who decides if is referring again the patient to the ophthalmologist. That's the organization in other countries we have. Here in Bolivia, for example, we have the opticians that make the eyesight, prescribe glasses. They have the knowledge about doing this. But if something is wrong, we have the chance to go just to the ophthalmologist. We can say it's easier, it's faster, but well, that's just another way to be organized in our country. And don't forget that practice is the price of mastery. Whatever you practice over and over again becomes a new habit of tone performance. So you can see it's not a long class. It's just going to the point, giving us some details, giving us some definitions that are important for this, well, at this point. And well, as I was telling you, tonight I'm gonna tell you which slides you are going to study. Study the abbreviations of the specialties, just the general ones that are into the presentation. The ortho, the PMG, PM and R, A and R, JYO, for example, like that, okay? And the allied medical professions. That's all. With those definitions, we have the chance to not to read everything, memorize everything. Hierarchy is not important at this point. We are going to talk about it into module 2. And well, I think that's all. At this point, do you have any question? All of you have the slides into the WhatsApp group. And, well, I think there is nothing else to say. Yes, Anna, let me know, please.
I just missed the last part. You said we need to study the abbreviations and then what?
I'm sorry, I couldn't listen to you very well. It's not clear your
Sorry. No, can you listen to me?
and not so clear.
Okay.
Or do you prefer?
I can tell you, I could understand what she said, teacher.
Okay, perfect.
She asked you what else do we have to study besides the abbreviation of the specialties?
No more. From this presentation, no more.
Okay, because you said something about the allied medical professions.
Yes, the
Yeah.
allied medical professionals are the most important part, I think. And some
Okay.
applications that are according to the specialties that I sent you in the diagram and how to choose a specialty, right?
Okay, teacher. Yeah, thank you.
Or let me show you again the slides for not making it a mistake. Let me see. Can you watch my screen?
Yes.
Perfect. Study this slide because you have here some abbreviations. And here you have more abbreviations, just details. And the allied medical professions. Maybe this one, well, it's not. We are going to talk about this organization in the module 2, so don't worry about it. Remember, again, right. This one, number 5, number 6, and the allied medical professions. One step. Okay, from here, from 19 and ahead, okay? 1, 2, 3, yes. And that's all. That's not too much information, okay?
Okay, teacher.
Okay, thank you.
6,
teacher.
19. Okay, I sent to the chat 5, 6, and 19 and ahead, okay? We're getting it
Okay,
clear.
thank you so much.
And then thanks to you. Thanks for your question, Anna. Is there any other question, maybe? I don't think so, right? So let me send you the pool to take attendance. Thank you. Thanks to everybody for being here at this hour. Thanks for helping me changing the schedule because, well, it was very important to go to a meeting at my son's school. It's a very, very important meeting tonight. Well, thanks for your help. I really appreciate that. So don't worry about it. Keep on reading. If there is any question from the slides, please, we can talk about it tomorrow. There is no trouble on this. And yes, I think that's all. So
Thank you, teacher. Have a good night.
have a good night. Thanks to you. So that's all. See you tomorrow during the workshop. We have the role, the same in the previous one. So if somebody is not attending, please let me know, okay? For correcting this. And don't forget the 5, 6, and 19 and ahead. I'm going to, that's all. And yes, I'm gonna send the key answer of the homework 3 now, because I said that today was the last chance. I said it in the previous workshop and the previous class. So let me send it, okay?
Okay, teacher.
Okay, miss, thank you.
Okay,
Okay.
Thank you so much.
Okay, so see you tomorrow. Bye-bye. Good night.
Okay, teacher, bye.
Good night,
Bye.
teacher. See you tomorrow.
See you tomorrow. Bye-bye.
Good night, teacher.
Good night. Hi, Charlene. If you want, fill the pool. That's okay for me. Charlene? Charlene, can you listen to me? Well, that's all. It's done. Charlene. Charlene. Well, Charlene, my dear, I'm gonna close all of this, okay? Because time's up, and well, I think you filled the pool. So see you tomorrow, dear. Have a great night.